No. If the dog is continually trying to sit down and you want them to stand, just cut underneath their bum or underneath here. It will stop them from sitting down. Obviously don't be too forceful. When you are presenting a dog for examinations, try and make sure they stand square or as square as possible, because then this will help with the overview of looking. And again, if they are trying to sit down while you're trying to stand them square, have a handler with you if you want, or if you feel you need to, and again, underneath here or underneath the belly there. Okay, Daisy, sit, sit, good girl. Now, lay down. She doesn't particularly like being lifted, so if I was to put her on a table for examination purposes, I would support her back and the under, and lift from underneath here. Because she's a larger dog, I would have possibly someone else help me as well, but she doesn't like to be lifted up. It could be due to pain reasons, or it can just be a preference that she doesn't like. And if you did have to require to move her onto a table, you could use a muzzle or another type of restraint, or if you're at a vet practice, sedation method may be applicable. Before handling a dog, you should always sanitize your hands and ask the owner if you can actually approach the dog in the first place. If they're relaxed, obviously you can continue, but if they are showing signs of aggression, like growling, barking at you, or they're in an aggressive stance, or even if they have the hairs on the back of their neck standing up, that is signs of aggressive behaviour. You should never hunch over a dog when approaching them, because that can be seen as aggressive. And when you do approach them, approach with a closed fist and low down so they don't see it as you going above them. And again, that can be seen as a sign of aggression. Whenever you're continuing to do palpations and working on the dog, you should always monitor the behaviour of the dog. Even if you do have a handler, you should be the primary one looking out for any changes in behaviour, because that is an indicator before anything can go wrong. And you're always trying to keep the handler, the dog, and yourself safe. Further pain or aggression, if there's too much pain or too much aggression, do not continue if you don't feel comfortable, because then that could lead to accidents or incidents occurring. Daisy, up. Good girl. You should always try and talk to a dog and reassure, pat, stroke, even when you are doing manipulations, things like that. Good girl. Before starting as well, and when you are first going into a new environment, always check your environment to make sure it's safe. For example, windows closed, doors closed, so the dog can't escape or cause any trouble. You should always look at the equipment being used as well. For example, the collar should be two fingers wide underneath the neck, and if the lead is appropriate as well, and if it doesn't have any snags or tears or something that could break easily, and is actually suitable for your dog that you're using. Sit, lay down, and go that way. Good girl. If a dog will go into lateral recumbency by laying down first, that is a better method to use. This is lateral recumbency when they lie on their side. This can be used for palpations or for massage reasons as well. It can also be used as a restraint method if you were to hold their limbs and secure your arm more over their neck, obviously not applying too much pressure because that could affect their breathing as well. But if a dog is maybe more difficult or a smaller dog, you can easily manipulate into lateral recumbency. If they aren't, if they're larger, you may need a handler to help you as well, just because they are a larger dog, for example, she may need help if she wouldn't lie down and just go onto her side quite easily.
Go.
Bony landmarks of the canine are the temporomandibular joint, the wing of Atlas, the dorsal spinous processes of the cervical, thoracic and lumbar, tubosacral, tubercoxy and tuber-ischii. Back and the greater trochanter, head of the femur, lateral condyle of the femur, on the inside, the medial malleolus of the tibia, the patella, the calcaneal tuberosity, the scapular spine, the acromion process of the scapular spine. Here we go. The cranial greater part, greater tuberosity of the humerus, the olecranon, and the accessory carpal bone down here. The superficial muscles for the canine are the masseter, which is for mastication and raises the mandible to the maxilla. You have the trapezius, which has a cervical and thoracic portion. When used together, this draws the scapula, it elevates the scapula, and separately either draws the scapula cranodorsally or caudodorsally. Then you have the cleidocephalicus, which is part of the brachiocephalicus, and that protracts the forelimb and laterally bends the neck. Good girl. The rhomboideus, okay, which elevates the scapula, goes along here and along the scapula, elevates the scapula and draws the scapula cranially. The serratus ventralis, which goes along here and along that way. It has a cervical and thoracic portion. This stabilises the trunk and can aid in inspiration and elevates the neck as well. And you have the supraspinatus. This extends the forelimb. Okay. Extends the scapula, and you have the infraspinatus. Come on, let me get. You have the infraspinatus, which extends the scapula and abducts the shoulder. You have 3 pectoral muscles, descending and transverse. They attach the forelimb to the trunk and retract the forelimb. The third one is the ascending pectoral, which again attaches the forelimb to the trunk, and this retracts the forelimb. Yeah, so the front ones protract, the hind ones retract. I'm doing this so she doesn't sit down as well. And then you have the deltoideus, which one's across here. This is a shoulder fixator. Latissimus dorsi, from there. This retracts the forelimb, draws the trunk cranially, and may aid in inspiration. The longissimus dorsi, which runs along the whole of the body. This stabilises the vertebral column, laterally bends the vertebral column and elevates the head and neck. The latissimus dorsi stabilises the lumbar vertebral column and laterally bends the vertebral column. Gluteus medius is a hip extensor and adducts the hind limb. Biceps femoris is a hip extensor and stifle and tarsus. And when it is not weight bearing, it flexes the stifle, and adducts the hind limb. There is semitendinosus as well. When it's weight bearing, it is a hip, stifle and tarsus extensor. When it is not weight bearing, it flexes the stifle, adducts the hind limb. Semimembranosus is a hip, stifle and tarsus extensor, and when it is not weight bearing, it abducts the hind limb. The gracchalis adducts the hind limb and is a hip flexor. It's located on the inside of the leg here. The pectineus, hind limb adductor and hip flexor. Good girl. And you have the gastrocnemius. Goes all the way along here. It's a tarsal extensor and stifle flexor. And the iliopus is a hip flexor and protracts the hind limb as well and stabilises the vertebral column. When putting on a bridle, make sure the handler is also standing the same side as you and they are wearing gloves and a hat for safety, and doors and gates are shut in case something does happen where the horse becomes loose. You could just stand. Yeah, thank you. Make sure that the bridle is previously fitted to the horse, or it is of a suitable length to where you can comfortably put it on the horse and tighten up the other fastenings. And when putting on the bridle, make sure you aren't pricking the horse in the eye or leaving it caught. over the eye or crushing the ear. With a bridle like this, you want to make sure it's not too tight over the nose, as it fits right where they are more fragile and can injure the horse possibly. Throat lash should have a piece underneath. Make sure there's enough space. Ask the handler to move at a safe distance away, so when you do move the horse, it's not in the way. Before moving the horse, make sure you put gloves on, because when you're handling, you always need to make sure you are wearing the correct PPE. And when leading a horse, always make sure you're holding the reins in both hands and are secure. Go. When handling a larger animal and when approaching a larger animal, if they're in the field, you should always approach from the shoulder area and talk to them before you approach, because then they can hear if you're coming, because you may startle them, which may cause them to kick out or be aggressive towards you. You should lead on being on the left-hand side of the horse. I am on the wrong side at the moment. And whenever you have a handler with you, they should always follow around with you and be on the same side as you, tying up correctly as well, so it's a release, quick release knot, so if the horse does pull away, it won't jar or injure themselves. And when you're looking at the environment, make sure all gates are shut, so if they do become loose, it's not an issue, it's easily contained and you can easily catch them without them causing injury to themselves or others, hopefully. When picking up the legs, go down and talk to them if you feel the need to. Place the leg gently back down again. Don't ever get too close to the hindquarters or stand directly behind the hindquarters. You are in the risk of being kicked then. Before, if the horse is in the stable and you're approaching the horse, make sure you look at it first, assess if they're being aggressive in any sort of nature, or if they're being territorial of their stable. You can look at them, stand outside their stable for a little bit so they get a bit more comfortable at a safe distance. Before handling horses or going to each horse, you should sanitise or clean your hands, and if you're going to a higher risk area that possibly may have diseases or something of that nature, you should either leave them till last on your list and completely change your clothes, because then you're reducing the risk of contamination to each horse, and again thoroughly wash your hands and make sure all your equipment is clean. then you are reducing the risk of transmitting any possible viruses or diseases to other horses or to different yards. Good girl. You should always wear protective gear as well. A hat when you're handling or leading the horse. You should be wearing gloves. It reduces the risk of you getting rope burn and possibly giving more friction, so you can actually hold the horse better as well. If you find the horse, if you're leading the horse up and down, if you're finding them being difficult to control or hard to handle, you can use a bridle or something which goes across their nose, which can tighten if you do pull. They can have a risk as well if they're not used correctly. They can injure the horse, and the handler should be very experienced with horses or have some experience and comfortable with handling horses, because you could cause more of an issue or problem if not. Good girl. Try and get them to stand as square as you can. Good girl. This is to assess and to see how they're standing and weight bearing. And then back and a few steps backwards as well. Good girl. The bony landmarks of the horse are temporomandibular joint, the wing of atlas, transverse processes C3, C4, C5, dorsal processes of the withers area, tubus sacral, tubus cocci, tubus ischii, the cranial greater trochanter of the head of the femur, lateral epicondyle of the femur, patella, lateral malleolus of the tibia, calcaneal tuberosity, scapular spine, cranially greater part tuberosity of the humerus, deltoid tuberosity, lateral epicondyle of the humerus, and accessory carpal bone. For the distal limb, you have the superficial digital flexor tendon, which starts at the medial lateral epicondyle of the humerus, and it goes down the leg and attaches at the bottom. This is for elbow extension, carpal and digital flexion as well. You have the deep digital flexor tendon, which does the same for carpal, elbow extension carpal and digital flexion as well, which runs medially from humerus down as well and attaches around the back. You have this suspensory ligament, which goes along and up here and more inside, and that is for overextension because it attaches from the front here of the metacarpal joint, prevents overextension of the metacarpal joint. Then you have the annular ligament, which is around the back here, and it kind of goes across and down in this part, and that holds the flexor tendon in place. You have the common extender, which attaches from the lateral anacanon of the humerus and runs all the way down. And the lateral extensor tendon from here goes down, and that is for metacarpal pharyngeal extension. And the collateral cartilage is in the foot here, which above bone and goes round and cushions, and is also attachments for the ligaments in the leg. The superficial muscles of the horse are the masseter, which is for mastication, and it elevates the mandible to the maxilla. The rectus capitis dorsalis major and minor elevates the head. The obliquus capitis cranialis extends the head and laterally bends it. The splenius elevates, extends and bends the head and neck laterally. The trapezius has two sections, cervical, thoracic. Together they elevate the scapula, separately draw the scapula cranodorsally and chordodorsally. The rhomboidus elevates the neck, the head and neck. Sternocephalicus opens the mouth and extends or flexes or inclines the neck. The brachiocephalicus has two sections, cleidomastoideus and cleidobrachialis. This protracts the forelimb and bends the head and neck laterally. Then serratus ventralis has a cervical region and a thoracic region. This suspends the trunk and elevates the neck. The subclavicus around and down. This suspends the trunk and elevates and extends the shoulder. The triceps brachii, there are two parts to it, the long head and the lateral. This extends the shoulder and flexes the elbow and protracts the forelimb. It retracts the forelimb. There are three pectorals descending, transverse, which comes from the middle and comes out. These attach the forelimb to the trunk and protract the forelimb, and the descending attaches the forelimb to the trunk and retracts the forelimb. The deltoideus is a shoulder fixes the shoulder, and long and attaches to the deltoid tuberosity. The latissimus dorsi is long and down. When the forelimb is fixed, it draws the trunk cranially. When it's not, it retracts the forelimb and may aid in inspiration. The longissimus dorsi goes throughout the whole thing, stabilises the vertebral column, elevates the neck. The latissimus dorsi, the iliocostalis, stabilises the lumbar vertebral column and moves the vertebral column laterally. Tensor fascia latae flexes the hip and abducts, protracts the hind limb. Gluteus medius extends the hip. Biceps femoris extends the hip and flexes the stifle and the hock. Extends the hip, flexes the stifle and the hock. Semitendinosus flexes the hip, stifle and hock. Semimembranosus does the same as the semitendinosus. Gastrocnemius. There, it retracts the hind limb and extends hock joints. The supraspinatus extends the shoulder, extends the scapula and stabilises it. The infraspinator extends the shoulder, the scapula